Hello everyone. Today, we're exploring the medication Lantus, which is also known by its generic name, insulin glargine. As always, this information is intended for educational purposes only. If you have any health-related questions or concerns, it's important to consult with a healthcare professional. Description: Lantus, or insulin glargine, is a long-acting insulin used to help manage blood sugar levels in people with diabetes. Administered via injection, this insulin works by helping glucose get into cells so your body can use it for energy. It's typically injected once daily at the same time each day to maintain a steady level of insulin in the body. Lantus is primarily prescribed for the treatment of type 1 and type 2 diabetes to help control high blood sugar. Proper use of Lantus can prevent complications from diabetes, such as kidney damage, blindness, nerve problems, and loss of limbs. Warnings: Insulin glargine, like other insulin products, requires careful handling and specific storage conditions. It should not be frozen and should be kept away from direct heat and light. It's important not to use the medication if it appears cloudy, has changed colors, or has any particles in it. Always check the label to make sure you have the correct type of insulin. Before taking this medicine. Before starting Lantus, inform your healthcare provider about all your medical conditions, especially if you have liver or kidney disease, as these conditions can affect how your body uses insulin. Tell your doctor about all the other medications you use, including herbs and supplements, because many substances can affect blood sugar levels and insulin needs. If you are pregnant, planning to become pregnant, or breastfeeding, discuss it with your doctor to ensure Lantus is safe for you. Side effects: While taking Lantus, some people may experience injection site reactions, such as pain, redness, or irritation. Hypoglycemia, or low blood sugar, is one of the most common side effects and can be severe. Symptoms include headache, dizziness, hunger, sweating, irritability, confusion, or shakiness. To help prevent hypoglycemia, it's important to eat meals regularly and not skip meals. Other side effects can include weight gain and swelling in your hands or feet. Rarely, some people may have an allergic reaction to Lantus. Symptoms of a serious allergic reaction include a rash, itching, swelling, especially of the face, tongue, and throat, severe dizziness, or trouble breathing. Interactions: Insulin glargine can interact with other drugs, vitamins, or herbs you may be taking. An interaction is when a substance changes the way a drug works. This can be harmful or prevent the drug from working well. Always let your healthcare provider know about all drugs you are taking to monitor for interactions. Dosage: The dosage of Lantus must be tailored to the individual based on the blood sugar monitoring, diabetes type, and response to the insulin. Your doctor will advise the best dosage for you. Never adjust your dose unless instructed by your healthcare provider. Avoid: While using Lantus, avoid any activities or substances that could impair your ability to notice signs of low blood sugar, such as alcohol. It's also advisable to avoid any unnecessary stress, which can affect blood sugar levels. Staying hydrated is important, but water intake should be consistent and not excessive. FAQ: People often ask if Lantus can be used in pediatric patients. Lantus has been approved for use in children 6 years of age and older with type 1 diabetes. However, its use in younger children and for type 2 diabetes in children is not as well documented, so it's best to discuss this with a healthcare provider. Closing: That concludes our discussion on Lantus, or insulin glargine. Remember, this session is designed to educate and not to replace the guidance of a healthcare provider. Always consult with a professional for medical advice and any questions you have about managing diabetes. Thank you for tuning in.